I want to digress a minute and say that I truly support what Governor Bryant's trying to do on education. I think Phil's got a plan that will work. I introduced and wrote the first charter school bill for Governor Fordyce when I was in the House. We passed it. It got convoluted because you had to get it passed and had to work with folks. But we did have a charter school bill, and when I was chair of education in the Senate, I really wanted to kill it because it was the sorriest charter school bill in the United States. I make no bones about that because it was. And we need a charter school bill that will work, that would allow our children to get a proper education in this state. It just does not make sense for us to continue down the road that we're on and not educate children. I commend Delbert for what he has done on 16th section land. That's another issue I've always had to deal with, and it was one that was contentious with us for my 4 terms in the legislature. Let me briefly say that the governor and I are friends. I want to make that very clear. We've known each other a long time, since he was investigating arson cases and I had some mysterious fires myself, and we will remain friends. We've got a long way to go. It's hard for me to get up here and talk about what I want to do, and I'm looking at Phil on the front row. All right, here's the bottom line. One way or another, we're going to have an insurance exchange in the state of Mississippi. It will either be run by the state or it will be run by the federal government. There are those at the Republican Governors Association that think that the federal government does not have the money to operate exchanges. Well, I wish that were true, because if that were true, maybe we could just migrate over and say, you guys come run it because you don't have the money to do it. But the truth of the matter is they do have the money. They have folded one organization into SOCIA. SOCIA has all the money. It's a huge umbrella under HHS, and they have money to operate an exchange. Now, where are we in the state of Mississippi? It's obvious that the governor and I are not on the same sheet of music on this particular issue, and I respect his opinion because he's got 24 other governors, I believe that's right, that's behind him on the Republican side. I happen to not agree with him, and there's a reason for it. I think that if we allow the federal government to come into our state and operate the exchanges, we will forever give up our ability as a state to regulate health insurance in this state. Our authority is somewhat limited today. It will be totally gone if we succumb to the federal government, and October 1 is the deadline. I mean, October 1, somebody's got to be operating an exchange. I have one other option. I could do a state partnership, but let me make it clear. I am not going to do a state partnership. If you do a state partnership, you're implementing what the federal government wants. Everything that they want done, they will dictate to you, and you will still have no say-so. It's just as bad as letting the federal government run the exchange. Now, here's the issue. The issue is HHS has not approved Mississippi's blueprint. We're the only state in the union they have not approved. I don't expect they will approve it this week. I will tell you this, that we will have an answer within the next 10 to 15 days, because they've got some deadlines themselves that they have to meet, and they will tell us, yes, you can go forward, or no, you can't. And it will not be on the authority issue. I think it will be over the fact of whether or not we could implement a state-based free market exchange and still have the ability to interact with other agencies in the state. I worry about that because I do not control Medicaid. I want to make it very clear I have nothing to do with Medicaid. That's a sticky wicket for somebody, and I'm glad that my governor is in charge of Medicaid and not me. I do know this, that if the federal government comes in and operates an exchange and the legislature does not expand Medicaid, the federal government will have the ability to take people off that exchange and add them to the Medicaid rolls, and the state cannot do anything about it because they can change the eligibility at that point, and they will do that. Now, the Republican Governors Association thinks that if we have a state-based exchange, it will be a portal to add people to the Medicaid rolls. That's a possibility if you have something called the MAGI. That's the Modified Adjusted Gross Income Calculator. It simply is a question like this. What is your income? Is it above this level or is it below this level? And it has to be verified by someone. I'm not the Internal Revenue Service. I don't want to be in that business. We do not have a MAGI at this time that's available in the state of Mississippi. I don't know if Medicaid will do one or not. That's something we hadn't been informed of. And I don't know if we will do one, if the feds may make us do one if we end up doing a state-based exchange. I can tell you this. We're continuing to do what we've been doing in the past. HHS has told us that the grants that we have in place now are solid. We don't have to pay them back. We can continue to administer the grants that we have. We will continue to develop the exchange technology that has to go with it. And if the feds want to operate the exchange and they come in October 1 and operate, then the technology that we do develop, we will try to get the high-risk pool to utilize for a free market exchange with no subsidy at all outside of what the federal government does. Why is that important to you in this room? It's important for two reasons. One, those employers who are small employers who have 50 or less employees, the number is 50 or less employees, are not subject to the fines, but will have to find group insurance for their employees or a place for their employees to buy health insurance. They will be limited to 2 or 3 markets. Those markets will be either the federal market, the multi-state market that the feds will operate, the free market, which some of us believe will still exist to some degree, or the exchanges, be they federal or be they state operated. If we have a free market exchange run by the state, we will have qualified health, essential health benefits that we have chosen for our state. If the feds operate it, they will essentially have the same health benefits for 2 days because they're already adding to the ones they've adopted. Our essential health benefits are the same thing that Blue Cross has for the largest small groups in the state. So that's what we've adopted on the state level. There are a couple of other things that are going to happen. There will be a tax imposed on the federal exchanges of 3.5%. We already know that the state plan, that's the plan that 200,000 state employees and dependents are on, will have to pay $63 per participant per year to the federal government to pay for reinsurance that we took a bite of the apple a year ago. So that's another $12.5 million hickey that we've got coming at us sometime in June or July. I've informed a couple of our legislative leaders that they need to be prepared for this when it comes down the pipe. We're looking at untold taxation coming at us to kind of finance Obamacare, as we call it. Have we used any state money to develop what we've done? You have to some degree if you paid me. But by and large, all of the dollars that we've spent on the development of the state-based exchanges come from grant money. Grant money is taxpayer money. Granted, it comes from us. It comes from other folks in the United States. But we take grant money every day. We just took $60-something million for the medical expansion here in Jackson day before yesterday when we had the groundbreaking. So it's not uncommon to take grants. But I will tell you this, that if we have to come back and develop this exchange ourselves, we've got to find somewhere between $40 and $60 million to develop the exchange. Now, the best caveat I can leave you with is some hope. If we do have a state-based exchange, and it's not up to the governor and I to decide that anymore, it's up to Kathleen Sebelius, the Secretary of HHS, then we have the possibility of adding 50 to 60,000 people on the exchange that normally would be put under the Medicaid rolls. These are the people between 100 and 138% of poverty level. Our poverty level is 133% for Medicaid eligibility plus a 5% deviation for income. Those people would be put on the exchange. 98% of their premium would be paid for by the federal government on the sliding scale, and those people would put up about $200 a year to have health insurance. To a provider like a hospital and a doctor, they get better benefits. There are better benefits than what they would get if they were serving those people under Medicaid. To the state of Mississippi, it saves between $1,000 to $2,000 on each person you put on the exchange, which regates to something like $50 to $100 million savings per year. If the feds operate the exchange, they're going to send them to Medicaid, and the state will have to find some funding mechanism. I don't know what will happen. It's in Kathleen Sebelius' hands today. We'll survive one way or another, and I will continue working for the citizens of this state and to try to develop some type of health care system that we can live with and continue to have employment. I will tell you what will happen to this state. If we do not provide some type of health benefits to our citizens, the jobs are going somewhere else. They will not stay in this state. When we survey folks, the number 2 thing for employees are the benefits that they receive from their employer. When you look at the surveys, we got one the other day from some health association that showed 72% approval rate on what we're doing, 52% in the 5 counties of Madison, Hines, Washington, another county. We think we're on the right track. Reasonable minds, smart minds can disagree and still remain friends, and I hope that's where we are today. Governor, thank you for letting me be here and talk to you. Phil, thank y'all. Thank you so much, Blake.